So, hello, my name is Michelle Pelling. I'm the lay member for quality and patient involvement at East Lancs CCG, which basically means it's my role to ensure that patients are at the heart of everything we do and that the patient, carer and community voice is heard. Now, part of that role is finding new ways to reach out to people and communicate, which for me is why I find digital connectivity so exciting. So it's a real pleasure to be invited along today to talk about something I'm very passionate about, almost last but not least. So prior to joining the CCG, I'd spent many years in the voluntary sector, very much on the front line, helping carers and patients to navigate health and social care. And when you spend any amount of time in that role, you quickly develop a strong sense of social responsibility, particularly towards people who are coping with incredible challenges every day. And ironically, the biggest challenges are usually the very system that should be there to help people actually provides the biggest barriers. So just to set a little bit more context, the majority of carers I supported were looking after people over the age of 65. Many of them had one or more long-term conditions. Quite a lot were housebound and some completely dependent on the care of their loved ones. And of course, I'm sure you're all aware that the biggest challenge facing the NHS at the moment is the rise of long-term conditions. A significant proportion of the NHS budget is spent managing the care of people who have them. Around 70% of the primary and secondary care budget is spent on them. And getting better at prevention, self-management and engaging with this group who tell us that they don't feel involved in their own care is incredibly important. So from my experience, these are the very people who could benefit the most from what digital approaches can bring, and certainly apps. And what I learnt in all that time is that older people value maintaining their independence more than anything else. So anything that can help them to keep at home and stay independent for as long as possible is incredibly important to them, particularly if it means that they don't have to welcome other people into the home. So many women of my mum's generation and older, the baby boomers, never learnt to drive. And what you often find is that it's a cruel twist of fate that when husbands or partners retire, sometimes an illness can take away people's ability to drive, and you see that all so often. And when you lose your licence, so much is taken away. I went to an event quite recently and I met an inspiring woman who has dementia, and she said it wasn't the dementia that had taken away her life, but losing a driving licence. If you lose your licence, you lose your life, and it's really, really powerful. But it doesn't have to be that way if we can encourage more people to embrace what digital can bring. But there's a problem with digital approaches for this demographic because many of them are computer phobic, and it's quite scary learning anything new at this age. So over the years, I referred many people onto courses like this, and whilst the evaluations were always very, very good and very, very positive, it didn't always follow that people would then go out and buy a computer. It's one thing going on a 6-week course, it's quite another going into a computer shop, buying the hardware, the software, the peripherals, taking it all home, putting it all together, getting it working, getting online with broadband, and then invariably it crashes. I've never known anyone's computer crash as much as my mum's. And we actually have this cartoon on the wall at the side of her computer because we all dread getting that phone call, my computer's crashed. But of course, we now have the tablet and we're in the midst of the smartphone revolution. The UK is now a smartphone society. And the best thing about tablets, smartphones, iPads is that they're intuitive. So you can pretty much take them straight out of the box, turn them on, and they're working. And half of all UK homes now have a tablet, and that's in just 5 years. So smartphones have become the hub of daily lives. Over 2/3 of adults have them, and even the 55 to 64-year-olds are starting to catch up, with their numbers doubling since 2012. So for older people, and we had a really good question earlier on, it's easy to populate a tablet or device with a few apps that are likely to be popular. The biggies are going to be things like TV and radio, a supermarket app for anyone who is housebound. It can be a real lifeline if you can do your shopping online and have it delivered to your door. And certainly I know my public health colleagues, I'm sure will agree, that transport's a massive issue for older people. Loneliness, we know, is more damaging to health than smoking. So Facebook, Skype, all the different social media apps, etc., really good at connecting people with friends and family. And they're proven to be very, very popular in nursing homes and residential homes as well. And gaming is a big growth area. We've got all the silver surfers going online, and it's great if you have insomnia because there's someone online whatever time of the day or night. And of course we've got the sad news that more and more libraries are closing, but on the internet or through an app you can have access to the world's biggest library. And if you're hard of hearing or visually impaired, you've got large print, you've got audio books, you can have your daily newspaper read out to you. You've got things like Dragon Dictation, so you can write a letter, send an email. And of course, so many services are now online, banking being a really big one. So my mother-in-law, she's completely anti-technology. And she's also hard of hearing. But we've managed to get her a mobile phone, and she's using it now to do text messaging. It's taken about a year, but she's using it. And I suspect as the time goes on and she loses her hearing completely, a smartphone will be an absolute lifeline for her. And the biggest difficulties, one of the biggest difficulties and challenges she faces is going to see a doctor. And she goes quite regular. And it means that she always has to take someone with her to translate what's happened and what the doctor said. And I think it'd be wonderful if she could go into that consultation, be fully involved in it with the help of perhaps a smartphone, and then following it be able to access what the GP said from her home. I think that would be quite transformational for her. So health apps clearly have a lot of application and a huge potential benefit in terms of self-management, self-care and even remote care. I've heard of practice nurses who use iTranslate to communicate with patients who've got language barriers. And there's so much potential for person-centred planning and person-centred care. So at Eastlancs CCG, we've been part of a successful vanguard with Airedale Hospital using telemedicine. And quite simply, this means that patients in care homes can access the clinical hub at the hospital without leaving the care home. And one of our GPs said that of all the changes introduced over the last 15 years, this is the only one that's actually reduced workload. So it's very, very popular. But more importantly, for the patient, it means that they can have a consultation with their doctor without leaving the care home. And for them, that's very, very important. And I think in the same way it's proven to be successful in hospital, it could be transformational for people who are housebound or need a lot of intensive care. And one of the carers I once visited, her mum was very, very poorly. She had complex health issues. She had COPD. We talked about that earlier. And just moving from one side of the room to the other was an absolute nightmare. So once a week or once a fortnight, she had to get her mother up, dressed, out of the house, down some steep steps, into the car, off to the health centre, out of the car, and all that back again. And it was an absolute nightmare. It was almost like a military operation. And all that was for her regular INR checks. And this lady was a nurse by background, and she could never understand why she couldn't help with the monitoring of the bloods from home, a bit like we do with diabetes. So I think there's lots of scope there. And for me, and for the 6 million unpaid carers who cope with incredibly difficult situations every day, with no training, no holidays and no sick pay, I would love to see primary care and hospitals providing patients with a digital health record and appropriate apps that they can use once they get home to help with the management of care. I think that that would have massive implications for people, preventing people being readmitted to hospital and repeat visits to GP practices. So personally, for me as a patient, I hope this is what the future looks like. For me, I'm interested in keeping well and avoiding long-term conditions for as long as possible. I have... broke the bag. We might not need that. I'll put it on though, because otherwise I don't get... So I have an Apple Watch, and I hope it actually superseded I had a Fitbit. Is it still working? Yeah. I had a Fitbit before this, which was really good at sort of tracking my daily activity. But I hope in the not too distant future that I can share the information from my watch with my doctor, and if there's anything that I need to be alerted of, I can take action quite quickly. It keeps going off today and it keeps telling me to stand up, so that's probably not too good. But at the moment, I can track my health progress just through accessing an app, but I know it could do so much more in the future. So I'm sure that this is more valuable to my GP than trawling back through my historic health record and looking at past illnesses. And I was really interested in, I can't remember if it was Bruce or Lloyd early on, who talked about having a patient-held health record, because I would certainly want one of those. But I'm also interested in good quality information for me and my family that has been accredited. So I've got that assurance around privacy and the security of information. And last slide. So it's amazing how far apps have come in just 5 years, and we can see that apps have application right across the health spectrum, whether it's genome and DNA, whether it's self-management, self-care, harnessing the potential power of the internet and its vast resources. Done well could mean that we move from health that's done to patients to health that's done for patients. The challenge, I think, for all of us is making sense of the sea of apps that's out there, and there are more coming online every day. And certainly the difficulty for commissioners and providers is that balance between potential solutions and what patients actually want. And there are some bigger questions as well around how do we know they're working, what are the outcomes, and I think relevant for all of us at the moment, how much are they saving? So thank you for that. I'll leave the stage intact.